do 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 do. Do 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ, but I've shrunk in size.
And we're addicted to health. Today, we are going to be addressing asthma, and we have a special guest with us today, Laura Diesenhaus.
Laura Diesenhaus.
Thank you.
There's an echo. Laura Diesenhaus.
House, yeah.
Before we get into our episode, we're going to talk a little bit more about what JJ is taking today.
Okay, the topic of our show today is asthma, and what I find is very helpful as a treatment for asthma, one of the many things you could do, is vitamin C. So I'm going to take this handy-dandy little vitamin C pill here. You can get them in capsules, you can get them in tablets, you can get them chewable, although if you're going to get a chewable one, don't take one with too much sugar in it. Anyway, vitamin C, very good for stabilizing your histamine cells, which could aggravate an asthma attack. Cheers.
Cheers. Very good. And I know that I take vitamin C every day, especially in the winter season to help fight colds as well. Great.
Asthma.
Asthma. So JJ, can you tell me what exactly is asthma?
Asthma is pretty much when you get a spasm, you get a restriction when you're breathing in, so you have something called an asthmatic attack. So that's when patients, clients will complain about how they just can't breathe, and often what you'll see in asthma with is they'll have a puffer, and they'll reach for their puffer and they'll puff, which will open up their airway and they'll be able to breathe again. It could be a very serious disease because you could run out of oxygen, you could pass out, and it's pretty common. I would say about 40% of my patients suffer from asthma. It's quite common. Sports-induced, cold-induced, etc.
So are those some of the triggers? Like what makes somebody have asthma?
Allergens, some people get it from cold, often pets, so allergens, pollen, pets, etc. Some people are more predisposed to it. It's a hypersensitivity reaction. They tend to have thicker mucus in their bronchioles, and it just seems to cause a spasm and obstruct their breathing. So,
Now, we're going to discuss a number of natural remedies to treat asthma, but is it possible through these remedies for them to get right off their puffers or their inhalers?
I wouldn't say they could get right off their puffers, but we could definitely have them maybe decrease the use of their puffers and actually improve their breathing. Definitely everything from osteopathy, which Laura will be talking about, the breathing exercises, to some of the supplements of vitamin C, quercetin, also elimination diets, because in many cases there's some foods in their diets that could be triggering and worsening this hypersensitivity reaction they get. So completely going off, some do, but for the most part we're looking more at decreasing their medication.
Very good. So you actually provided a very quick overview of some of the different things that people can do to treat asthma from a natural perspective. And since we have Laura here as an osteopathic practitioner, can you explain osteopathically what it is that people can do?
Well, again, because the reaction that occurs with asthma is so much related to it's a breathing response, what commonly happens with people with asthma is that they end up in a sort of posture where they're sort of hunched up a little bit, what we call a kyphotic posture frequently, and they're using what we call accessory muscles of respiration a lot, which are the muscles up in the neck and the collarbone, and they end up over time, because it's a chronic condition, with sort of a rigid chest. So they're breathing a lot up here, they're not using their lower rib cage, and things get tight and constricted. So one of the main focuses of osteopathy with asthma is to sort of make the breathing mechanism much more pliable, the way it should be, so that people can take deeper breaths again, can really get more air into those airways, and even through that breathing sometimes relax themselves to a point where the spasm can reduce. Because again, we're not aiming to replace bronchodilators or puffers, because those are very important, but there is a way to get them to respond differently by making their whole physiological mechanism for breathing more efficient again. So, for example, there's some techniques I thought I'd show to sort of demonstrate that. So, JJ, I'm going to get you to take your shirt off for me.
Sweet.
So the things that we use for breathing, I said that that people with asthma tend to use the muscles up here too much. What we want to emphasize is to get the ribs to expand more openly the way they used to. So we're trying to get the rib joints. There's joints in the back here, where the ribs attach to the spine. There's joints in the front near the chest bone. But a warm heart,
Cold hands, but a warm heart.
And we want those joints to be more pliable, and the muscles between the ribs, the intercostal muscles and the diaphragm, to work better. So one thing, and remember I said there was a hunched posture, so one thing that we do sometimes just to start to get some mobility is, you're going to put your head on my shoulder, is you want to get actually into the ribs in the back, and the upper back, and you want to lean the person forward, and we actually kind of do exercises where we're lifting and sort of bringing them out of that kyphotic posture so that they can stretch in a way that they haven't been able to stretch for a long time. So there's ways to sort of get them to move in a way to lift the spine, open up the ribs, and that's one approach to getting some more mobility into the rib cage that wasn't there before. Another way is to actually work on the shoulder blades, because the shoulder blades have muscles that support them and can actually get also very tight and restricted and prevent the rib cage from fully expanding. So I will get under the shoulder blade with digging in with my thumb a little bit and try to actually lift it, and there's a way to sort of follow the tissues and get them to relax so you can get more mobility and then more expansion of the lungs.
It's actually quite sore.
It's often really sore. Those muscles are used for a lot of things and overused for a lot of things. So that's in terms of, trying to get the muscles to expand more. And we work with the diaphragm quite a lot as well. So getting under the diaphragm and massaging the diaphragm muscles, because the diaphragm goes all the way around the back. It's a huge muscle.
She tickled me. You didn't see that, but she tickled me.
It's part of my job to tickle people. Loosens them up.
Sweet, good. That's good. Loosens the
Thank
stiffness.
Thank you very much. Stiffness in the spirit. No. So one other thing, though, to talk about also is that it's not just about getting the rib cage to move more. It's also about getting at some of what we call the neurological control for the lungs, so that the neurological response is a bit more normalized, right? So if you lie on your back for a second.
Okay.
So in osteopathy, we're not just interested in just getting muscles and joints to move. We realize that the neurological control for normal function is also really important, but those nerves have to be able to have a free pathway. So one of the nerves that is involved with lung function actually comes right out of the base of the head, and where it comes out, it actually feeds into all kinds of structures that get tight up in the neck area and into the shoulders and pull people back up into that posture that we're trying to get them out of. So often we'll come under the head, and actually my hands are sort of interlaced like this, and there's a way to sort of release some of the back of the head where these nerves come out, and to sort of get them to, it's like they can pass their signals a lot more efficiently. They have a freer flow of circulation, and that in turn can help the lungs to function more normally or react more normally to an irritant or to whatever's causing the asthmatic reaction. So we're sort of working on a number of different levels to get the person to breathe more deeply and to react more normally.
Thank you very much, Laura. I enjoyed the treatment so much. Decided to never wear a shirt ever again.
Amazing effect.
I apologize to our listeners and viewers already. You won't see any more shirts in the near future.
It's not the usual treatment effect, but that's okay.
It's true, but I breathe so much better with the shirt off. Anyway, thank you very much, as usual. Always a pleasure. Please come and visit us at www.vitaminjunkies.com and join the addiction and subscribe to our weekly podcast.
That's also where you can find a practitioner in your local community. If you'd like to find an osteopathic practitioner or a naturopath, you can do it there on the Find
With
Practitioner
shirt on or
logo.
off?
You can prefer shirtless or not. And while you're on our website, please take the survey. Let us know where you're from, what your interests are. We want to create episodes that meet your needs. And for anybody who takes a survey from North America, they will also be entered into a draw for a $100 prize pack from Hey Jude.
$100.
Thank you so much for joining us. I'm Jennifer Lyle.
I'm Dr. JJ.
And I'm Laura Diesenhaus.
And continue the addiction to good health.
Do, 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 do. Do, 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 do. Do, 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 do.